Hi everyone, Jacob Dev. This is Roxana, and today I'm going to be talking to you on the topic of Maharishi Ayurveda's approach to multiple sclerosis. So, what causes multiple sclerosis? It's an autoimmune disease that creates a lot of unpredictability in the body. It's a disease where the immune system attacks the myelin sheaths that cover the nerves. You can see here what it looks like when it's normal, and then when things are damaged, how they kind of diminish. It disrupts communication between the brain and the rest of the body, and then ultimately the nerves might deteriorate to an irreversible state if you're considering allopathic medicine and their approach to it. In Ayurvedic medicine, the foundation of Ayurveda's belief around multiple sclerosis, and typically in most diseases, is that it would be caused by imbalances in the physiology, buildup of toxins and impurities in the tissues, reduced immune system response, lack of overall healing ability in the body, and then accumulation of mental and physical stress. And according to Ayurveda theory, multiple sclerosis is an imbalance and deterioration of the nervous system's strength and stability. So from this perspective, there are a number of components that have to be implemented in order to restore balance, help healing, and help boost the body's natural healing ability, so that way we can alleviate and pacify those symptoms of multiple sclerosis. So some of these we'll review later, but balancing the nervous system by diet, nutrition, digestion, and metabolism, knowing what the state of their Agni is, and understanding what's going on with Ama and being able to help in that arena, also cleansing the tissues and removing toxins and impurities, strengthening the body's natural immune response and enlivening the body's natural healing ability, reducing stress so we can introduce the transcendental meditation technique, and that helps reverse the body's response to stress, as well as incorporating a lifestyle and daily routine adjustment will be really beneficial for these patients. We're looking at detecting multiple sclerosis. So what are the signs and symptoms? Well, we see that there will be vision problems, tingling, numbness, pain, spasms, weakness, fatigue, balance, dizziness, cognitive problems, those sorts of things. A correlation to living in higher latitudes when one is born could be an issue of genetics. It could also result from significant traumas that can create a disturbance in the central nervous system. And why would the latitude be a contributing factor? Well, you consider the terrain in these areas. They're home to many mountainous regions, and the rate of injury from outdoor athletics is very high in these areas. And coupling that with any other risk factors can potentially increase the likelihood of developing symptoms of multiple sclerosis. Continuing on, so from an Ayurvedic perspective, the cause of disorders. So this is a pathology that involves usually two doshas, Pitta and Kapha. Pitta is the manager of heat in the body, and it attacks the nerve sheaths, Majadhatu, and those are controlled by Kapha. So this disease usually is classified as maybe Kapha Roga because the Dhatu under Kapha's control is being damaged and it ceases to function correctly. So that would mean that Kapha is vitiated here and reduced, and then therefore would increase Vata. And then we see how there's that element of Pitta that comes in and heats things and dries everything out. So the causes of this pathology are considered to be due to an excessive dosha accumulation mixed with Ama or non-digested food. Different mixes of dosha and Ama cause different manifestations of this disease, but any dosha can cause this pathology. Some Vata pathology causes dryness and Majadhatu, and that leads to inflammation, which is Pitta, and the development of Kapha to be able to lubricate and maintain this Dhatu correctly is unavailable. And so this form takes on the attributes of Vata. There's a lot of irregularity, a lot of volatility, there's stress, activation. It's worse in autumn and early winter. And then there are difficulties with coordination and balance and those sorts of things. Some pitta pathology causes inflammation in Majadatu, invades the domain of kapha, and then this form takes on the attributes of pitta, so regularity, relapse, inflammation, those things are more pronounced. It affects pitta organs, and that worsens in the spring and summer months, where the client will usually suffer from visual problems. Some kapha pathology causes inflammation, just pitta, and it manifests due to congestive nature. So kapha prevents normal circulation of pitta, the pitta increases, and then it starts to attack the kapha tissue, Majadatu. And then this form takes on the attributes of kapha: regular, congestive, progressive. There's less inflammation, but there are emotional symptoms or depression and unstable moods. Worse in late winter and early spring, as is typical with kapha dosha. Other combinations are vata causing samapitta, and they move to Majadatu, which is vatasha. Vata causing samakapha to move into Majadatu, and vata moving samavata into Majadatu. This example can be used to understand pitta and kapha type pathologies, mixing with any form of ama and dosha to attack or lodge into the Majadatu. It's important to determine the causal dosha, and not only the dosha mixed in with the ama. All forms of this condition reflect a typical ama pathology. As ama accumulates in the body, it moves through the circulation, and it's deposited in various locations in the body. And once the ama is deposited, it begins to attack tissue and provides an environment favorable for viral or bacterial growth. And that sticky ama also causes inflammation of the tissue that it's attached to, either with or without bacterial infection. The Ayurvedic point of view is that ama is the main cause behind autoimmune disorders, and that cannot be forgotten or ignored. Multiple sclerosis is classified as an autoimmune disease because the body's immune system attacks and damages the myelin. And this occurs because ama is attached to the nerve tissues, and the immune response tries to remove it. This results in immunity attacking the nerve tissue, which has difficulty to separate from the ama that is attached to the myelin sheath. Genetic variations are also an issue here, and that could account for ama being deposited on Majadatu versus other dhatus. Other factors that account for ama being deposited here are overuse of the nervous system, like stress or working too much or shock. Injury to it at any time prior to the manifestation of the disease is also a factor. Lifestyle habits like smoking, lack of exercise, these are major factors. Diet is a primary factor in ama production, so therefore we would want to consider that as treatment because it can also be a primary cause for MS. Other lifestyle factors like working with toxic chemicals, solvents, that sort of thing will favor the increase of ama in the body. So moving along, treatment for multiple sclerosis. So we want to create a balanced solution for our client. From an allopathic perspective, there is no known cure for MS. Treatments attempt to return function after an attack or prevent new attacks, prevent disability, and a lot of the medications can have adverse effects on the body or be poorly tolerated, and many patients tend to pursue alternative treatments because of this. Multiple sclerosis is classified as a disease that is difficult to cure in Ayurveda, but curable in earlier stages. It becomes incurable after the nerve myelin is lost or damaged beyond the body's ability to repair it. But we never want to say that something is impossible in Ayurveda. So it is easier to treat it in the first 2 years because it's easy to reverse the pathology. And then depending on the person, it can still be curable up to 10 years. But in most cases, it's really challenging if the person has been dealing with this for 10 years or more. In Ayurveda, we treat with Langana therapies to remove ama and dosha accumulation, and if possible, using purifying methods like Shodhana and panchakarma to remove doshas and ama deposits in the body. If that's not possible, then shamana therapies can be used with the person over a longer period of time. Shamana therapies are preferable when the patient is too young or too old or too weak, too debilitated, or they don't have the financial means to perform strong Shodhana therapy each year for 3 or 4 years. I'm going to move along to the slide. Herbal recommendations to enliven the inner intelligence. So here we have listed Brahmi Godakola and Shak Pushpi ghee. We would want to take these internally. Brahmi Grita, incorporating that into a golden milk would be great. Amrit Kalash, Veda 2402, Veda 2803, and Veda 2415. These are all really great, and we need to make sure that we are aware of their Agni before we suggest a dosage for Veda 2402 and 2803. So continuing on, here are some lifestyle recommendations: regular TM, eating fresh organic vata pacifying foods, and then herbs that will enliven the inner intelligence of Majadhatu. Movement, having fun, enjoying life, engaging in friendships that foster positivity, spend some time outdoors, create rituals that soothe and calm and nurture. The primary form of shamana therapy is lifestyle or dinacharya. So Ayurvedic lifestyle will include dietary rules, daily schedules. When vata causes dosha and ama to move in, we want to remove coffee from the diet. Black or green tea can be taken a little bit per day. If you drink soft drinks, stop them immediately. No cigarettes. If the patient is smoking more than 5 per day, then a gradual reduction over 1 or 2 months. And reduce or stopping all forms of alcohol from the diet. Small amounts of red wine can be taken. Using ginger tea plus digestive spices to increase Agni. Increase regularity in life. That's a great habit to have, because schedules for eating, sleeping, and work and all of these sorts of things are going to help regularity in the body and reduce vata. So make a daily plan to wake up, apply a thin layer of sesame oil on the body, put 1 or 2 drops of sesame oil in each nostril, have a hot drink like ginger tea, 10 minutes of pranayama, have a shower, dress for the day, stay warm, eat warm food in small amounts in the morning, and if you're not hungry, and then if you are, then a little bit larger amounts of food are fine. Go to work, do your daily activities, make sure to stop and eat lunch midday, and eat warm foods as possible. Try to avoid cold food or raw food, that sort of thing. Salads can be eaten after a warm meal. It's also important to remember that the main meal should be at lunchtime. And then return to your regular activities for the rest of the day. You can have a hot beverage later in the afternoon. Avoid sweets, avoid candy bars, that sort of thing. And then when you return home from work, eat an evening meal earlier rather than later, because you want to have space between your meal and going to bed for the evening. Avoid dairy products at night, no yogurt or creamy foods. Eat lighter at that time of day rather than you would at midday. So no dessert or snacks after eating. If there's a problem in the evening after dinner not to eat sweets, then you should sit at least 10 minutes and do breathing exercises that you did in the morning. And then before you go to sleep, apply a little sesame oil to the bottom of your feet, cover them with socks, and then you can go to bed. Try to be in bed at 10. And if that's a struggle for you, then work incrementally backwards. We want to be able to increase our immunity by being able to digest and assimilate what we eat. And we also need to make sure that we're eating things that we can digest. And this is a starting point. The anti-ama diet, or amapachana, will be needed before proceeding with long-term nutritional programs, and is definitely indicated here. So just making sure that we engage our clients to alleviate stress and stay regular with the routine and do things that make you happy. I want to thank all of the contributors to this beautiful knowledge. Jai Gurudev.